What's up guys, I hope you're doing okay. I hope you're having a great time, because I am having a great time. Today we're going to talk about systematic lupus erythematosus, which is a chronic systemic inflammatory autoimmune disease. What the hell does that mean? This means that the patient's immune system, which is supposed to defend the body against infections, becomes dysregulated and mistakenly attacks its own cells and tissues, particularly at the level of the nucleus. This disease is characterized by the presence of autoantibodies, which are antibodies produced against cell structures, notably against double-stranded DNA inside the cell nucleus. These autoantibodies cause inflammation and damage in multiple organs, unfortunately. The diagnosis is based on a combination of both clinical and biological findings, and there is no single test that confirms the disease, but rather an accumulation of successive signs that allow for a confident diagnosis. Well, the average age of disease onset is around 30 years. Lupus affects women much more frequently than men, with a strong female predominance. The vital prognosis may be threatened in cases of some complications, infections, renal involvement, and neurological involvement. Infections are the leading cause of mortality in lupus patients. They can sometimes be the revealing feature of the disease. Renal involvement is the second leading cause of death. It can progress to chronic kidney failure and sometimes requiring transplantation. Neurological involvement. This is the third cause of death. Lupus can affect the central nervous system, which means the brain or spinal cord, or on the other hand, the peripheral nervous system, causing various neurological disorders, sometimes more severe, like seizures, psychosis, or cognitive disorders, etc. When it comes to pathophysiology, the hard part, this autoimmune disorder results from a combination of hormonal, environmental, and drug-related and genetic factors, which together lead to an inappropriate immune response, as we said before. First of all, hormonal role. The role of 6 hormones, particularly estrogen, is well established in the development and worsening of lupus. Female predominance of the disease is partly explained by this hormonal influence. It is observed that this predominance is less marked before puberty and after menopause, periods during which estrogen levels are a little bit lower. The use of estrogen, progesterone, oral contraceptives can also worsen the disease or promote its onset. The disease may also worsen during pregnancy as well as the postpartum period, linked to the major hormonal changes occurring at those times. Secondly, certain environmental factors can trigger or worsen this disease in predisposed individuals. Sun exposure is a very well-known aggravating factor in lupus. Ultraviolet rays induce apoptosis of the skin cells, releasing nuclear antigens against which the immune system reacts. Thirdly, certain medications can induce lupus in patients who initially did not have the disease. This drug-induced lupus is generally reversible upon discontinuation of the treatment. And finally, genetic predisposition is also found. Lupus is often more severe in people of African or Asian origin, linked to certain HLA types and other genetic factors involved in the regulation of the immune system. All these factors contribute to a type 3 hypersensitivity. This type 3 hypersensitivity is characterized by lymphopenia. What the is lymphopenia? Lymphopenia is a decrease in the number of lymphocytes, plus complement consumptions, particularly of the C3 and C4 fractions, whose level are decreased. Thirdly, an increase in anti-nuclear antibodies. These immunological abnormalities can lead to various clinical manifestations affecting both the skin and many internal organs, explaining the complexity and potential severity of this disease. Well, I hope this information and this video was helpful to you, and if you have any question, no matter what question, just ask it below, and if you have any comments, just comment below. Thank you so much for watching till the end, and I'll see you in the next videos. We will talk about clinical science, diagnosis and treatment, and probably other stuff. Thank you so much for watching again, and I'll see you in the next video. Bye bye.